Hello, Brian Gleis here from the Scott Insurance Agency. Hope you're having a great day. This video is going to talk about Medicare in 2025 and the changes that the Inflation Reduction Act are going to have on the majority of my Medicare recipients. So each year, it's always important to make sure you're looking for your annual notice of change in the mail, whether that annual notice of change is for your standalone prescription drug program that is packaged with your Medicare supplement, or it's in reference to your Medicare Advantage plan. All of those will have an annual notice of change. And one of the reasons why I know is because Mom just got hers. It was sitting on the table for me last night to look at whenever I came over to her house for dinner. Thanks for dinner, Mom. But the annual notice of change is a side-by-side comparison of the changes that will happen in 2025 compared to what was in 2024. There's some new things in play, and one of them is called the Inflation Reduction Act. It's primarily going to have an impact on the prescription drug coverages that you have. Again, doesn't matter whether you're on a supplement and standalone prescription drug or a Medicare Advantage plan. So last year in 2024, there was a donut hole. The donut hole was reached when an individual had what they call true out-of-pocket costs on their drugs of $5,030. Once you entered the donut hole, you had to pay 25% of your drug costs. So instead of a simple copay, you had to pay 25% of the drug, and you saw your costs go up. Typically, that generates a phone call to me, and my client says, Brian, there's a problem. I'm paying more at the pharmacy. And we'll look into it, and we'll say, yeah, you're in the donut hole. You have to pay 25% of the costs until you reach $8,000. That's $8,000. And once you've done that, you're in the catastrophic coverage and you don't have to pay anything. The problem with that whole scenario was it ran on a calendar year between January and December. And by the time someone made it to the donut hole, through the donut hole, and got to the catastrophic phase, December was almost around the corner and everything reset. So the Inflation Reduction Act in 2025 is going to change the numbers that you have to meet, and it's going to lower them somewhat substantially. It's eliminating the coverage gap or the donut hole. I'm going to say that again. It's eliminating the coverage gap or the donut hole. We've been waiting for that to happen for a long time, but in 2025, it's actually going to occur. So previously, in order for you to pay $0 for your drugs, you had to reach that limit of $8,000. In 2025, that limit is coming down to $2,000. Yes, you heard that correctly. After $2,000 of true out-of-pocket costs, you will not have to pay anything more for your medication during the year. And this is in reference to the Inflation Reduction Act. So with all good things, potentially there's an offsetting, I don't want to call it bad or negative. We'll call it whatever it is, price increase on the other end. So if you're on a Medicare supplement with a standalone prescription drug plan, we believe that the cost of those standalone prescription drug plans are going to increase. You'll know this through your annual notice of change that I was telling you about. But if you're on a Medicare supplement and a standalone prescription drug plan, get into your insurance agent's office between October 15th and December 7th so that they can run your meds in the program to see which standalone prescription drug plan will be best for you. For those of you on the Medicare supplements and standalone prescription drug plan, this change, the price increase, not on your drugs, but on the price of the actual plan that you've subscribed to, it may go up enough that you're going to potentially make a change from a supplement to a Medicare Advantage plan. We'll be able to help you determine if that's a good idea, if it's best for your budget. We'll make sure your doctors are in network. We'll make sure your medications are covered. It's not a stressful thing as long as you're working with a broker. Please do not do business with a 1-800 number. This stuff's too complicated to do over the phone, in my opinion. I use a whiteboard. I draw on the whiteboard. We use the paperwork. We use everything to try to make a complicated situation make sense. Now, I've been talking about a Medicare supplement and a standalone prescription drug. Let me switch gears and talk about the Medicare Advantage plan, because the Inflation Reduction Act will also affect the Medicare Advantage plans. Not as drastically as it will the supplements and standalone drug plans, because the standalone drug plans don't have any fat, they don't have any fluff, they don't have anything they can manipulate. Where on the Medicare Advantage side, they do. They have quite a few things. We might be seeing things such as a "I've fallen and can't get up" button won't be available anymore. We might see a reduction in some of the benefits, but an increase in the others. We might see a deductible on the prescription drug side that we haven't seen before. So all of this stuff comes out October 15th through December 7th. All of the companies that do the supplements and the Advantage plans are required to have their material released no later than October 15th. So as usual, we're saying hurry up and wait, but there's going to be a lot of confusion out there as prices start going up and you're saying, what's going on? Make sure you're working with a local broker, please. I personally would love to be that broker, but if I'm not, work with a local broker. Don't work with a 1-800 number. The devil's in the details, and there's too many details for you to do it on your own, in my opinion. Of course, that's a little self-serving because I want to be your agent, of course. But I am pleased to say that I have helped so many people with this. I've got good relationships with them. And I know when they have questions, they're going to call me first. And that's important because in today's world, having that backup is more important than everything. So in summary, changes coming in 2025 due to the Inflation Reduction Act. You're going to see the elimination of the donut hole and or the coverage gap. Those words can be used in tandem with each other. And you're going to see a drastic reduction in the amount of true out-of-pocket costs that you need to spend before you qualify for $0 drugs for the rest of the year. So that is it in a nutshell. Give us a call if we can help. I have actually made a separate video on there's a topic called the Medicare smoothing provision. And the Medicare smoothing provision is new for 2025. For most of you out there, you may not have to worry about it, but if you are on a considerable amount of medications and will easily meet that $2,000 threshold, that Medicare smoothing provision may be able to help make it yet even more affordable by breaking that $2,000 into monthly payments spread over the remainder of the calendar year. So check out that video that I've made. We're here to help as always. My name's Brian Gleiss. I'm with the Scott Insurance Agency. And let's see, what's the best joke I can come up with? We Medicare about you. Yes, we do. And no, that's not a joke. We do care about you, but let's have a little fun while we're doing it. Thank you for your business. If you find this video helpful, please share it with your friends and family. Bye-bye.